Tēnā koutou katoa, ko Kathy Beasley, tōku ingoa, no Hokianga ia. Although originally from Aberdeen in Scotland, in case the accent doesn't give it away, I trained in Dundee, gained some experience in the UK before heading over to New Zealand in 2001 for 1 year's working holiday and to gain some overseas experience. And here is where I remain. At times it can be quite challenging being so far away from my family. However, I have gained a second family while working and living in the Hokianga. For the past 16 years, I've had the pleasure of working at the centre of the universe in Rawene for Hokianga Health Services. Hokianga Health Services services a population of about 6,500 enrolled population plus all year round visitors. Of the enrolled population, we sit about just over 70% Maori. Our deprivation rating is a 10, and so you can imagine that this is associated with some high health needs across the population. Despite this, Hokianga is a very special and unique privileged place to live and work. The manner of the people, the love and the sharing that they give you, to have the opportunity to work amongst an extended family every day you go to work, that is something that you cannot put a price on. Hence why I'm still there after this many years. The terrain at times can be challenging, and some of the roads you do wonder if they technically can be called a road. And there are times when sometimes you just cannot get there, not unless you own a boat. So going back about 7 years ago now, I was hanging out in the Hokianga, feeling quite content with life, when they decided as an organisation to offer a position for someone to train into the role as a nurse practitioner. At that stage, I sure couldn't see that being me. However, my colleagues saw something in me I think that I didn't quite see, and they encouraged me to put forward my application. That was the beginning of a whirlwind 3-year adventure whereby I did part-time study, part-time working and part-time mother. I undertook a clinical master's via the University of Auckland. Unlike as today, the pathway was much less clearly defined, and despite that I would encourage anyone that's going to look at the nurse practitioner pathway to ensure that your papers are relevant and going to be useful when you get to the end. This includes, if you've got some idea of how you're going to use your nurse practitioner role, ensure you use your assignments to demonstrate that across the spectrum, because then you can reuse that information in your portfolio that you're putting to council as well. So about 4 years ago now, 4 or 5 years ago, I qualified as a nurse practitioner in primary healthcare. Yay, you think. Well, another new journey was just beginning. As part of my clinical masters, I did my research on cardiac rehabilitation in rural Northland, as it appeared to be that there was a gap in the delivery of this within our service. Consequently, this became a focus of my role. So while looking at primary health care across the lifespan, the area of cardiac rehab was developed for me. Within the cardiac rehabilitation role, my focus has been and remains to be about trying to deliver a service that is appropriate to what the patient needs. In some instances, this may be in the clinics. In other instances, this may be in the patient's homes. I have met people in car parks, in maraes, and sometimes just over the telephone. Under the umbrella as a nurse practitioner, I see a range of patients, and I'm just going to give you a rough idea of the sort of cases I may see as I go along. An example would be perhaps someone who has had congestive heart failure, who secondary to perhaps atrial fibrillation, would be discharged home, and I will receive a referral to advise of their discharge. I will then arrange to make contact with the patient, and depending on what they wish, I will arrange to meet with them to decide what is needed from me. This initial contact I aim to do within 1 to 2 weeks after discharge. I find at this point they're beautiful sponges of information. They want to know lots about their condition and they are keen to engage and eager to learn. Within that, the consult content is guided by what the patient needs from me. Often patients will have financial concerns, and this may involve looking at their work and income entitlements and completing disability allowances where appropriate to engage them in certain services. Often there's medication concerns and looking at the best ways of delivering the medication, blister packs being one option available. Looking forward, I like to ensure patients have the accessibility to reach healthcare without delays from financial concerns. Sometimes this will be a St. John ambulance subscription. Alternatively, it's about home monitoring for them if they need INRs, blood pressures, cardiorespiratory examinations, blood tests. I will try and help that patient to get what they need from their healthcare. Sometimes this will involve titration of medications, often diuretics, antihypertensives, to get them to their optimal health, and of course sometimes diabetes, which often goes along with the heart conditions. Talking about diet, because it's a very confusing subject with all the evidence and research that is published on a daily basis, 1 egg or 2. Sometimes this will be about helping them to recognise their symptoms, undertaking daily weights and supporting them in understanding what the results of those weights are and what steps need to be taken about them. And also a lot of my patients have their specialist follow-ups to be taken care of too, and so ensuring that these happen in a timely fashion and ensuring that the patient has a means of getting to that appointment to ensure that we don't have DNAs where we don't need them. In rural practice, I don't think I know anyone who wears just one hat, and I'm sure most of you are in the same position whereby you do several different things in addition to your primary role. In my case, one of my interests, I guess I would say, is in point of care testing, and I have actively been involved in a research project at the Hokianga over the past couple of years, which we're now in the process of writing up. This involves overseeing the point of care equipment we have in place, training of staff, monitoring of any errors, looking after the quality control aspect in an oversight role now more than in a hands-on role, which has been good. At a national level, I have been involved with the Rural Nurses New Zealand group for the past year, and we are beavering away at trying to improve access for rural nurses to education, study, funding, and it's certainly lots of fun working with this fantastic group of ladies. I am also involved with the Primary Options Group Northland and the Diabetes Strategic Advisory Group. At a local level, I sit on the Clinical Governance on Significant Events Meetings groups. I'm not suggesting by any means that you need to be running around doing all these various aspects. However, I would encourage anyone looking to be a nurse practitioner to have involvement at that next level of nursing, because it's about having that voice, it's about developing nursing, and it's about growing a workforce that's responsive to our patient needs. And sitting on these forums is one way of ensuring that voice is heard. And that sort of brings me to the end of what I have to offer you today. Apologies I wasn't able to join you in person, but hopefully I've given a little bit of insight. And so basically humans are 90% water, basically cucumbers with anxiety. Don't be anxious about progressing your nursing. It's what you're already doing, but just progressing it to the next level. And I guess what I'd like to say is, when I was in the UK, we were in a train station and there was a sign came up on the wall saying, "Kathy is a queue dodger." My kids thought this was hilarious. However, down the bottom in small print it actually stated, more people should be like Kathy and buy their tickets online. And so I would challenge you today to be like Kathy and consider becoming a nurse practitioner, It is a rewarding job, and the more nurse practitioners we have, the more healthcare we can provide. Enjoy the rest of your day, and hopefully I'll meet you in person sometime soon. Ka kite anō.